With us now are Michelle and Dr. Halpert, and we're going to be learning about veins, but so much more. Welcome to the show, guys. How are you?
Very good, thanks.
Well, thank you. Good morning.
So when I found out what it was that you actually do, because it's mobile, is in your name, and I was like, oh, does that mean like you go to somebody's house? And you said, no, we're mobile, meaning you're going, but you're going to a certain location.
Okay.
Tell us how that works, Dr. Halpert. Tell us about mobile.
So like any other vascular practice, when we start, we're a typical outpatient practice where we have our patients that are coming over to the office as much as they can make it there.
Okay.
And what we did realize with time, and pretty quickly, that the patients that really did need our care, the patients, the older folks that had a harder time making their way out of their homes, patients that had swollen legs, the kind of things that can turn into wounds, they have a hard time making their way over. And slowly we started offering services that would be able to deliver at least the diagnostic and the consultation and evaluation part of things to them and to their facilities.
They're not as ambulatory sometimes, especially when you're talking about the veins, right? So it's funny because I said to you, when someone finds out that you work with varicose veins, do they always kind of like go like this and be like, hey, can you help me here? And hey, can you help me there? So I believe, I don't have that many of them, but I was a cheerleader in high school and I was always like doing that, boom, boom. I think I might have caused permanent damage. Is that a possibility?
Anything is possible.
You never know. You never know. So Michelle, you've been with the practice for 2.5 years as the Director of Client Services. What have you seen with this ability to actually go out and to work in long-term care facilities and things like that?
So we bring that clinic-like experience to the nursing home, right, where it's very hard for the patients to come out to the outpatient setting, and we have doctors and PAs and nurse practitioners go on site at the patient's bedside and really bring that service to them where they may not be able to get it.
And do you work with them because you know they're doing a great job and it gives you joy?
Job. The team is awesome. The management team is amazing, and they're literally always available and right by your side throughout the whole process. So it's definitely been a great journey.
Now, what I didn't realize is that vascular doesn't just mean veins. It can mean other things. It could mean is the lymphatic. That sounds like symphonic system, but no. Well, tell me.
You're talking
tell me about
lymphatics,
that.
But really, it's what we focus on is peripheral arterial disease, peripheral venous disease, which is what you're touching on. But as interventionalists, what we do is minimally invasive surgery. We do the kind of procedures that the patients often would not be good candidates for the conventional surgeries. So things like angiograms. It used to be open heart surgeries that cardiac surgeons are doing. These days, we can do them, and it's not my specialty.
Okay.
But that's the kind of thing that most folks understand, where we're able to do these coronary angiograms from the arteries and the veins somewhere in the legs, typically in the femur and the femoral artery or in the wrist. And we're able to really do advanced surgical interventions with the kind of techniques that let them go home right away.
And as a communication specialist, what did you learn that you thought was surprising, that you thought maybe the public didn't know, that you wanted to make sure that they could get some help around?
I think that we do a lot of hand-holding with the families and their primary care physicians, and really connecting all the dots where the doctors might not be available, and really delivering that concierge service to them, both in the long-term care facilities and in the community practice. And I think that there's a lot within our scope that they might not be familiar with that we can help treat.
And when you're working with the population where, you know, it probably gives them comfort to know that they could stay in the facility where they are and that you're coming to them.
That's very good. So Michelle's actually drumming her position down a little bit. She, I would say probably a big part of the success and the growth of our practice was involved her and her team and training. And that's because of the, not just the concierge service, but it's understanding that a lot of the older folks and patients in general don't really have a full understanding often after just one doctor visit.
Okay.
Family that wants to be involved but couldn't make their way over, especially during the COVID season where things were just impossible. And Michelle really pulled it together for us. And what we realized, not just mobile bringing our services to the facility, but hand-holding really with a concierge approach, making sure to call the family before, calling them after. Doctors, as much as I'd like to think I'm not, can really be I don't know, I'm trying not to use a bad word, but we could really lack a lot of that bedside manner that not just patients, but their family that's suffering with not being with their family and their loved ones. And that's something I think that Michelle has really brought to our team and to our patients, and it's improved the outcomes and satisfaction scores across the board.
Well, and I think too, because science, right? You have to have so much information, right? And science and math is always an absolute, right? So when it comes to those soft skills that kind of can explain the science, you got to work together as a team.
Absolutely.
So I think that's fantastic. Yeah. What's one success story that you, as a team, or you could share with me where you said, wow, you know what, that was a good day. We were able to go in, we helped a patient, and now they were able to live a more happier life?
So we have, from the mobile aspect, in terms of going out to facilities and having our staff make their way there, there are patients, I could think of several, but one young gentleman of about 70 was a stroke victim. His family didn't want him making his way out because they're worried about COVID issues. Unfortunately, he had a blood clot, and the blood clot was to the extent that his leg was very, very swollen.
Okay.
Not to mention it's also just dangerous for his own health. And we were able to make our way in, diagnose it, so that we can tell them what the issues are. And then Michelle and her team were able to help make sure that the family was comfortable enough for them to make their way over to our office, and we were able to help them and clear it out.
Well, I thank you both very much. It's wonderful that you learned how to do a different, have your services, but in a different way. Like we're all kind of trying new things and exploring new opportunities, and congratulations to you and your entire team. And thank you for being here. And after we close, will you look at that big? No, I'm just joking. We hope that we brought you some information. We always try to educate you, to entertain you, and we find such value from all the letters we've gotten from our audience in the past. So this might be something that you want to start in your community, and if so, reach out to them. I'm sure that they'll help you. Be well.